Hello everyone, my name is Anthony Miller Jr. and I am part of Group J. I will be narrating our presentation on high cost of healthcare in the United States. First off, we will start with some history. In the 60s, Medicaid was created and the start of expanded coverage arrived. In the 80s was when the expansion of that era stopped, as well as inflation in price. The 80s also brought about a change in these price inflations to help keep spending fair. The 90s saw another rise in prices after less restrictions of healthcare plans was implemented. And in the 2000s, other insurance plans as well as generic drugs saw growth during the most recent recession. Here we have a graph displaying how our nation's spending in health is distributed. As you can see, the majority of our spending goes towards hospitals and clinical care. Now breaking our expenditures down to a per year basis between 1970 and 2018. We observe a continuous, nearly exponential increase as years go by, going from $355 to $11,172. Health spending per person increased by over 31-fold in less than 50 years' time. In this slide, we list the causes or influences that are the root of cost changes in healthcare. These tendencies are easily noted in the health cost history of the United States slide that was presented earlier and include policy changes, legislation, recessions, prices, and public and private initiatives. Policy changes and past legislation will either have a positive or negative effect on health costs depending on their restrictive versus more flexible nature. History has shown that when restrictions are lifted, the cost of health care tends to rise. However, a recession will have a tendency to lower health spending because the general population naturally has less to spend. Overall prices of health care consistently rise with the passing of years. Sometimes this jump in healthcare prices can be more drastic though, such as the high inflation of prices between 1966 and 1982. Public and private initiatives may have similar effects on health costs as policy changes. The organization we chose to focus our presentation on is Kaiser Permanente, a hospital and insurance provider. Kaiser Permanente's mission is, just as it states, to provide high-quality, affordable healthcare services and to improve the health of their members and the communities they serve. Looking back at the foundational stages of the creation of Kaiser Permanente, this organization's current vision has served at the epicenter of their ideals through years of diligent construct and opportunity. We'll take a look at these founding steps now. Kaiser Permanente's background began with Dr. Sidney Garfield, a young surgeon who saw an opportunity and had the desire to serve the health needs of a community working to build the Colorado River Aqueduct project. He built a hospital and helped injured and sick workers. However, he couldn't keep up with the financing because he would often help those who couldn't pay by not charging them. Insurance companies were slow to pay their portions after the fact. This marked a pivotal moment in his entrepreneurial career when the prepayment idea was suggested to him. This allowed him to receive a monthly payment from insurance companies and individual workers in order to give them preventative and emergency care in advance for all their needs. The idea was a great success for all parties. Nearing the end of the Colorado River Aqueduct project, he crossed paths with Henry J. Kaiser, an industrialist who requested Dr. Garfield continue his health payment method through his building project of the Grand Coulee Dam. This was the founding of Garfield and Kaiser's business relationship as it continued with their plans during World War II at the Kaiser shipyards in 1941. On July 21st, 1945, the health plan opened to the public and Kaiser Permanente was officially born. It has helped many people receive affordable health care who otherwise may not have been able to obtain it, through to the present day. The founders of Kaiser Permanente may have been Garfield and Kaiser, but the key leader we chose for our presentation is their current CEO and chairman, Gregory A. Adams. He is a determined and dedicated healthcare executive with 30 plus years of leadership experience, most of which has been loyally served as a valued team member within Kaiser Permanente. Because of his many years of dedication to Kaiser Permanente, he has had an influential role in leading transformation and encouraging collaboration to improvement of patient care outcomes, as well as driving his commitment to providing high-quality care and coverage for its 12.2 million members. Adams is also a member of the National Association of Health Services Executives, and the Executive Leadership Council. He worked closely with the former CEO of Kaiser Permanente and is known for his desire to make a change by continuing to strive to fulfill and promote the commendable vision of the late CEO of providing quality and affordable care to those most in need. Kaiser Permanente, led by Gregory Adams, already have taken concrete steps to lower healthcare costs. First, Kaiser Permanente has announced partnerships with cities around social determinants of health. They also will be soon opening the Kaiser Permanente School of Medicine, which will train healthcare professionals in an integrated health model focused on total health. The school will also be working with Permanente medical groups for truly collaborative care. Although we feel that Gregory Adams is currently in pretty good standing and exhibits quality traits, there are a few points that he can proactively steer away from. First, having a strong background in nursing, Adams can be prone to having a narrow perspective to his primary field. If he is aware of this possible flaw, he can be careful to accommodate everyone, no matter their role or position. Secondly, after 3+ years in a particular field, he may become comfortable and become stuck in his ways, negatively impacting his leadership abilities. He can stay away from this negative trait by keeping an open mind to new ideas and improvements, as well as constantly adjusting to fit the needs of his members and organization. Lastly, because of his nursing background, it would benefit Adams to be aware of favoritism and being biased towards nurses. That is our presentation. Here are our references. Thank you for watching.